So chances are if you're here, you've got a really serious question on your mind about what a diagnosis of Addison's disease actually means for the future. And we're going to tackle that question head on. So let's just dive right in.
Okay, so this is it, right? The big question, the one that really matters most. Can having Addison's disease shorten your life? Let's just get the most important answer out on the table right away.
And the answer, which comes to us from Healthline, is actually incredibly reassuring. A long life isn't just some vague possibility, it's the expected outcome. But, and this is a really big but, it all hangs on that one condition, with the right approach. So what does appropriate management actually look like? Well, that's what we're going to break down.
First things first, to really get a handle on this, we need to understand what exactly we're dealing with. And it all comes down to a couple of crucial hormones that your body just isn't making enough of.
To put it simply, Addison's disease is basically a deficiency. Your adrenal glands, these little guys that sit right on top of your kidneys, they're just not producing what they're supposed to. And for most people, this isn't something that hits you like a ton of bricks. The symptoms tend to creep in slowly over a pretty long period of time.
Let's look at the two main players here. You've got cortisol, which you can think of as your body's built-in stress manager. It also handles things like your blood sugar and immune system. Then there's aldosterone. This one's like the master chemist, making sure your salt and water levels are perfectly balanced to keep your blood pressure stable. The problem is, when you're running low on both of these, your body's whole operating system just starts to get out of whack. And that disruption, that out of whackness, can lead to what is without a doubt the single biggest risk for anyone with Addison's disease. This is the one thing that all the management, all the treatment is designed to prevent, something called an adrenal crisis. So what is an adrenal crisis? It's when those already low hormone levels suddenly just plummet. It's like the whole system just crashes. And I want to be super clear here. This is a life-threatening medical emergency. It's not something you can wait out or tough out. It needs immediate medical help.
Knowing the warning signs is absolutely critical, and this is why it's so dangerous. You see that severe drop in blood pressure? That's the lack of aldosterone doing its thing. And those electrolyte imbalances? That's not just a number on a chart. That can directly mess with your heart's ability to beat properly. So yeah, recognizing these signs is a huge part of managing the disease.
Okay, so how often does this actually happen? Well, researchers figure that about 8% of people with this condition might have a crisis in any given year. And while that's not zero, look at the other side of that chart. The vast majority, 92%, do not. This tells us that with the right care, a crisis is absolutely not a sure thing.
But, and this is why everyone takes it so seriously, of the people who do have a crisis, somewhere between 0.5% and 2% might die from it. So you see, the entire goal of treatment is to keep you in that 92% group, and to make sure that if a crisis ever happens, it gets treated right away.
So how do we do that? How do we prevent a crisis and manage everything for the long haul? Well, the answer is treatment. But as we're about to see, it's a really delicate balancing act.
You know, at its core, the logic is about as simple as it gets. If your body isn't making enough of something, you just give it back. The whole goal is to manually do the job that the adrenal glands aren't able to do on their own anymore.
But here's where that balancing act really comes into play. On one hand, the treatment is literally life-saving. These steroid medications like hydrocortisone and fludrocortisone are the essential replacements that stop a crisis from happening and let you live a normal life. But on the other hand, being on these medications for years and years brings its own set of challenges you have to manage, like a higher risk for infections or maybe some issues with blood sugar.
All right, so let's pull all of this together and circle back to where we started. But now we have a much clearer idea of both the challenges and the solutions. So what's the actual path to that full, long life we talked about at the beginning?
Here's the main takeaway, the most important thing to remember. That positive outlook, that long life we started with, it's real, but it's not passive. It's not something that just happens to you. It's an outcome you achieve through conscious, daily, active management of both the disease and its treatment.
Now, you might see some older studies that talk about a potential loss of life years, and we have to face that statistic head-on. But you have to understand this is not the destiny for everyone with Addison's. This number reflects what can happen in the worst-case scenarios, with severe complications, repeated infections, or unmanaged crises, which are the very things that active management is designed to prevent.
At the end of the day, it really just boils down to these 4 things. Taking your medication exactly as prescribed, every single time. Knowing the signs of a crisis and having a plan. working with your doctor to stay on top of any long-term side effects from the meds, and maybe most important of all, being a true partner with your healthcare team.
And that really leaves us with one final thought. This isn't just about taking pills or following orders. It's about owning your health. It's about learning everything you can, speaking up, and being your own best advocate. So the real question to leave you with is this: what's your next step to becoming the most active, informed partner you can possibly be in your own health journey?